Okay. I think we can just jump right into it right now. On this edition of HCA's monthly webinar, we're going to be talking about transforming the African healthcare ecosystem through health tech startups, and exploring how healthcare professionals can be a part of this growth and development. We also have a special speaker here who would also be helping elaborate on what the problems and challenges are in the health tech ecosystem and sharing her personal story being a healthcare professional herself. So please give me a minute. I'll share my screen that we can jump into it. Great. Melissa, can you see my screen, please?
Yes, I can.
Fantastic. So like I said, we're looking at the state of the healthcare ecosystem and the role of healthcare startups in the ecosystem. We'll be going through the state of the healthcare ecosystem, the role of health tech startups, a snapshot of the African startup ecosystem, and what the value proposition would be for investors. Then Melissa will take us through her journey as a healthcare professional and a nurse and a key player in the health tech ecosystem. So first of all, we as Africans, we know the state of infrastructure and the healthcare, even without having statistical data. Just from our day-to-day experiences, we see how difficult it has been to access basic amenities or access basic needs that would enable us, improve our standard of living and the state of our health. According to the World Bank, Africa has the worst healthcare outcome in the world. We make up 16% of the world population, carry 25% of the global burden in the world, because most of this epidemic diseases and tropical diseases are mostly in developing areas, being Africa. And regardless of that, we still account for just 1% of the total global health expenditure. Mortality rates are going up. Fetal mortality rates are going up. 70% of the global maternal deaths in the world are in Africa. 2% of the global clinical trials occur in Africa. Over 35% mortality rate of children that are born on a day-to-day basis in Africa. We have a little less than 50% medical and healthcare efficiency, and there's a huge financing gap in the healthcare ecosystem. According to the World Health Organization, there are key pillars that lead to the growth or that hold up the healthcare system in Africa. They are service delivery, health workforce, health information systems, access to essential medicine, financing, and leadership and governance. And over time, we have seen that health tech startups have been able to plug most of the gaps and the challenges that are being faced in these traditional systems. They've been raising funds, building on the technology and the innovation to scale the problems that we have in our traditional healthcare ecosystem rather. And this is one of the things that have created an environment where people can sit in their homes and order drugs from a pharmacy, or sit in your homes and call a doctor who will diagnose a problem that you have through this health tech startups. So just like any other startup ecosystem, or just like any other startup vertical, we've seen the health tech system in Nigeria and Africa grow over time. In Africa, the health tech startup ecosystem received $181 million in 2022. Of the unicorns, unicorns are startups that have over $1 billion valuation, and we have over 70 of them in the globe from the health tech ecosystem. We also have the health tech ecosystem as the third largest unicorn generating sector in the startup ecosystem. We have over 1,000 health tech startups in Africa who have seen a 50% year-on-year growth from 2023 to 2027, or are predicted to see a 15% year-on-year growth from 2023 to 2027. The market value of the health tech ecosystem is looking to be around $11 billion by 2025. And we can see that most of these health tech ecosystems, or most of these health tech startups, are typically around the large metropolis and booming areas in Africa. For investors looking to, or healthcare professionals rather, and investors looking to improve the state of the African healthcare system, to improve the lives of Africans within the economy, investing in the health tech ecosystem is a no-brainer. And it's not just because of the impact. We've also seen exponential returns over time. It gives them access to innovation, to be at the forefront of disruptive technologies. It also helps investors to diversify their portfolio. So as opposed to having only traditional asset classes like we see for most people, real estate, public equity, public traded assets, they also have the opportunity to expand their portfolio into venture-based and tech-based asset classes and instruments, as well as being at the top of social impact and of living for Africans across the world. So this is an overview of what we can see in the market, but obviously it would be better to get the perspective of someone who is a key player in the health tech ecosystem, as well as has experience with the inefficiencies and the gaps that could be seen in the healthcare ecosystem, which is why I have our speaker for today, who also happens to be a founder in the portfolio of HealthCap Africa, Melissa Baim. She is the CEO and co-founder of Infuse Health. She also is a registered nurse and has received several awards. So I'm just going to let Melissa jump into her presentation. Please, Melissa, you have the floor.
Sure. Thank you so much, Audrey. Hello, everyone. My name is Melissa Bimi, and I am the founder of Infuse Health. So, brief background about myself. I am a nurse, a registered nurse as well. I am originally from Cameroon. And, I'm so happy to be here today to talk about the vital role that I think healthcare professionals play within the healthcare startup ecosystem that, and address a couple of things that were unknown to me that I wish that somebody could have, told me when I was, again, I didn't do clinical practice, but when I was in nursing school and really just trying to figure out what I wanted to do, I'm so happy to be able to get to share that here today with you guys as well. So again, the purpose of this seminar is really to talk about why we should all be builders, right? Whether we are healthcare professionals, whether we're technologists, the most important thing I think that we need to learn from here is that we should all adopt this mentality of being builders and finding solutions to problems that we face. And I will go back, in time to say a little bit about like how Infuse started and really just what we've been up to since then. But I went to nursing school, and up until 2018, when I left nursing school, I started Infuse Health. And at that time, we have evolved over a couple of years to do very many different things. But when we started out, we really started out as a blood donor database and a blood delivery service. So we wanted to be able to help patients that needed blood by delivering blood to them, and help blood banks find and recruit more blood donors for these blood banks. And all these sort of ideas that I worked on were based off of my own personal experiences that I had with the healthcare ecosystem or the healthcare climate in Cameroon and mostly West Africa, where I was exposed to at that time. And that was always where, I got inspiration from in terms of the types of ideas that I wanted to pursue as a healthcare entrepreneur, as a healthcare builder. And so, from starting as a blood donor delivery service and a blood donor recruitment platform, we sort of evolved into clinical trials and clinical research where, instead of recruiting patients just or recruiting people just to donate blood, we started recruiting for clinical trials and clinical research. Again, very heavily driven by COVID, driven by the fact that, we had actual people and actual, clients reaching out to us saying, if you could recruit people for, blood donations or blood donors, can you recruit them to take part in COVID research, right? So that we could find a vaccine or a cure to this disease that was ravaging the world at that time. And that's how, now we switched up to working in the clinical research and the clinical trial space, which has been, I think that it's a bigger surface area for luck. We have more like unlimited, as a business, obviously, you always have to think about that just in terms of what is your surface area that you should be addressing or your total addressable market, and not necessarily from the fact that, doing blood donor sourcing and blood delivery was still a very real problem. It still is a very real problem that, needs to be addressed. But at the same time, we always had to take into consideration like commercialization and who was paying for this and how we were navigating that. And so, again, we're still thinking about that, but we really just decided to focus more on the clinical trials or the clinical research space. And so today, my talk is really just going to revolve around why I think healthcare is so different than any other industry and why it's very important that the people that are building in healthcare are people that understand healthcare, right? When you think of other industries like, finance or fintech or, agri-tech or whatever other industries there are, you don't necessarily have to have any sort of direct sort of expertise in these fields. I mean, expertise is great, but when you think about those and you think about healthcare, there's a reason why, we're going to school for 4 years, 7 years, years and years to be able to learn how to take care of people. And that's because healthcare is very different from every other industry. And the first and the most primary reason for this is there are actually people involved. Like when you're thinking about healthcare, it's the fact that you're literally dealing with people's lives, which is kind of something that, other industries don't really have to grapple with. Like a mistake that you make in fintech, yes, you probably like lose somebody's life savings, but they don't die, right? Like, but with us, it's a situation where people could literally lose their lives if we don't take care. And that's why healthcare is different. The second thing is the people that we serve in healthcare come to us in their most vulnerable states. When you're seeing people in a hospital, when you're seeing people who are sick who need healthcare services, a lot of these times, these people are looking up to you to make the best decisions for them. And sometimes these best decisions don't always align with the best decisions financially, right? Like you're thinking about, am I saving this person's life? Am I giving them blood? Or am I saying, oh, you have to pay me before I give you blood? So those are some of the things that, when it comes to healthcare, you're thinking about it. And other industries don't have to grapple with that, but we do. And so you always have to think about people before profits. Like that's always a thing in healthcare, is that are you thinking of, you took your Hippocratic oath, you took your Nightingale oath, you took whatever oath that you took before becoming a healthcare professional. And when you're taking this oath, you're saying your goal is to serve and to protect these people that are coming to you. And most importantly is there are repercussions, right? There are regulatory frameworks in place. You just can't like joke around in healthcare. There are people that go to jail, so there are obviously consequences to our actions when it comes to healthcare. And that's why healthcare is obviously like a very scary, I think, vertical. I think that's why a lot of people don't like healthcare, because there are just so many ways that things could go wrong. And if you're thinking about it from an entrepreneurial perspective, entrepreneurship itself is already so risky. So why would you pick a vertical that just adds a lot more risk onto like an already existing, risky situation? So that is healthcare in a snapshot, and why healthcare is so different from other categories. And it's also just important with this sort of like problems, it's important why we should be the ones building, why healthcare professionals. And for healthcare professionals, I'm thinking about everybody on the value chain, right? From physicians to nurses to the lab people to anybody that sort of comes in contact with the healthcare establishment just makes it a better person to build in healthcare. A physician could be like a really good person to be an entrepreneur, could be a really good person to own a hospital, could be a really good person. There are so many different types of verticals. A pharmacist could be like a really good person to like open a pharmaceutical company. So there are so many sort of like things that we need to be thinking about across the entire value chain. If you're somebody that finds yourself in a healthcare establishment, in a hospital, or any sort of patient-facing, hospital-facing vertical, you really should be the ones building in this category. And there are a couple of things that work in your favor and why you can be better at building in healthcare than somebody that is not within healthcare. And the first thing is that you already sort of build trust and you establish trust based off of your accolades or your qualifications. For me, for example, every time I tell people I am a nurse, it's a lot easier for me to have conversations with doctors, with patients, because they trust that, first of all, as somebody who again comes from that profession, they trust my opinion or they trust what it is that I'm saying. So that's always sort of like the first thing that comes, is that you are already at an advantage because people trust you. That whatever qualification that you have after your name builds trust with whatever stakeholders that you're interfacing with. The second thing is you already sort of have networks and in-depth expertise, and networks could just be, for me, some of the networks that I tapped into were always like people that I went to school with. It could be hospitals that I interned at when, I was in nursing school. For certain people that have actually worked in clinical settings, I feel like they have a lot more deeper networks because you have colleagues, you have all these people that, you can always reach out to if you want to get like a partnership with a hospital. It could be a hospital that you've already worked with, so you already know some director that can make things move along. So you already have these networks, as opposed to somebody that is just not part of the ecosystem and is just coming here and say, oh, there's money in healthcare, let's go make money, right? So that's something that we always have to think about. And most of all, your ethical compass, I think, is a lot better positioned than somebody that is not from healthcare. Again, we make all of these oaths when we enter into these professions. And a lot of the times, for me, for example, my ultimate drive within healthcare has always been patience. And I think that is really just because of the fact that I spend, a lot of time with patients, and I saw people really just coming into hospitals trying to look for help, trying to get help. And so my compass has always been around, how do I build something that is helpful for patients? How do I build something that, is really going to drive better experiences and better outcomes for these patients? And I think that that's always just, irrespective of whatever I do or irrespective of whatever products we're building, that sort of patient experience is always at the back of my mind. It's always, what about the patients? What are we doing for the patients? And that's it. But I understand, right? Like, I understand why we're not coming into this. I've been there, and I understand why a lot more healthcare professionals are not coming into the building context of healthcare. And I think the first thing is obviously the fact that we just focus a lot more on like the clinical aspect. We focus a lot more on like, bedside, clinical, hospital settings. And it's totally understandable. I didn't know that there were other things that I could do with my nursing degree until I started doing it. Throughout nursing school, I knew that I wanted to do something. I didn't want to work in the hospital. I didn't want to work at the bedside. There were so many problems that I just did not want to be a part of. But I didn't see anything else. There was like nothing else that showed me in terms of the fact that I could be a nurse and I could do something else that was not healthcare related or that was not hospital related. And so I think that that's why events like this are important for people to be able to see. If I'd ever seen nurses, I mean, there were physicians, but still, it's not as much as I should have seen. But if I'd ever seen nurses that, left the bedside and went to start companies, and not only companies, but went to building technology, that would have been something that I think would have really started preparing me from nursing school in terms of like what this outcome was going to be like. So the first thing of why I think we're not building is we're not seeing other representation in terms of what else could we do as healthcare professionals. The second thing is a lot of the times people are not willing to commit fully, right? Like you have to figure out, am I working as a nurse? Am I pulling a 12-hour shift? Am I working 18 hours today? Or am I sitting down to build a company? So a lot of the times people have to figure out how to juggle the time commitment that comes with, building a company, how to, put in the sacrifices that come with building a company, how to put yourself out there when it comes to building a company. So that's always something that I think is also a hindrance. And the third and most, something that I think is so accurate to Africa is just how complex healthcare is. Especially when it comes to Africa, you're dealing with so many different countries, so many different types of like regulations and frameworks. So a lot of the times people are thinking, am I building for Nigeria? Am I building for Cameroon? Am I building for South Africa? What am I doing, right? Like, how do I figure that out? And for a lot of us who are not originally from like, huge countries, for example, Cameroon is about 25 million. That is like less than a quarter of Nigeria, for example. You always have to think, is what I'm building enough for this to be like a full-time business? If I say I want to deliver blood, how much blood do I have to deliver for this to make sense? So those are sort of like the things that I think are hindrances as to why we're not building in Africa, which again, as I said, totally understandable, but makes sense. But it's so important for us to think about the fact that there is so much supporting data and evidence that shows that companies that are founded by healthcare professionals, perform better financially. So we have like better financial performances. Companies that are founded by healthcare professionals, they offer better quality of care to the patients that they serve. Companies that are founded by healthcare innovators, they are just more innovative. And the reason for this is, again, just based off of my experiences, is you're constantly thinking about problems that really are particular to patients. Like you're not guessing problems. You're not, oh, what do patients want, right? Like for me, I knew that people needed blood. That was, again, that is still a very real problem, not just in Africa, even in the States, even in like other places, that's still like a very real problem. And also the data supports that investors just place a lot more confidence in healthcare teams that have clinical expertise. Again, for me, I think that that is very real because the fact that I am a nurse, it permitted us to go on to raise capital. It really permitted us to be able to build this company, which I don't know how I would have done that if I did not have sort of like the clinical expertise or the clinical experience that I have. So with all of this data supporting why we need to build, I think that this really outweighs some of the challenges that we've faced before, right? And some of the problems that I have explained before with regards to like why we shouldn't build. And so today my call for action, or with anybody on this call, what I would like to say is, if you're an investor, if you're thinking about building, the things that you need to start thinking about is, how do you get the right type of support and mentorship that you would need? And again, this could be reaching out to, if you're a physician, you could reach out to other physician entrepreneurs. If you're a nurse, you can reach out to nurse entrepreneurs. That's a very growing community. If you're a laboratory person, you reach out to laboratory entrepreneurs. So the goal here is always think about all these people that, even though may not be as many, but are pursuing these other paths within healthcare that are not necessarily clinical, and start thinking about, okay, how do I reach out? If I'm a nurse, how do I reach out to Melissa and say, Melissa, how did you, navigate, I don't know, not working in a hospital, but having to build a company, and how did you navigate that? Like, those are the real types of things that you should be able to like reach out to ask. The next thing is that people just need a little bit more exposure. You need to be able to think outside of your comfort zone, outside of your country. I think that, again, for me, that was particularly relevant because I had to stop thinking from just like Cameroon, for example, and I started thinking, okay, how do I build and understand Nigeria, right? How do I build and understand South Africa? So you have to expose yourself into other sort of like systems that are different from yours, because it gives you a lot more ideas. Again, the goal here is that as an entrepreneur, your goal is always to keep trying new ideas. You could try and fail, but if you're not exposing yourself to those new ideas, then it really doesn't help. So you need that sort of exposure. You need to be able to put yourself out there and say, what am I doing? And I think that just to even like emphasize on this importance of exposure, for me, one of the things was moving to the States as well and learning that I could build even for the States. Like those were things that I never even imagined when I was in Africa. Like to think that I could come here as an African and, try to build and incorporate solutions that would be more relevant to like Western or people in the States as well. I think that again is just another important example of why it's important to expose yourself and be in these super uncomfortable situations that could lead to you just like opening up your brain and thinking a lot more outside the box. And while you're doing that, you need to eat, right? Like you need to pay people, you need to do all of that. So there are so many different types of like funding mechanisms. You could apply for grants, you could apply for awards, you could start talking to investors. Investors obviously it takes a while to build up to that, but always start thinking about the fact that if you want to go all in into building this, how do you successfully do that and detach yourself from the fact that you probably were getting a monthly salary at a hospital, but now you want to build? Because I know that that is a friction point. People are thinking, I'm not going to be building a company if I'm working in this space that pays me a salary or whatever. So you always have to start thinking, how do I fund this dream? How do I make sure that I don't know if you're talking to your parents, if your parents have it like that, but it's always you thinking about the fact that how am I making sure that I wake up tomorrow and I'm still able to want to keep building for healthcare. And it's so important because, as I said, there are so many problems, which some of which Audrey outlined in healthcare, and we just cannot keep going and working in the same systems and working in the same places that just annoy us. You're working in a hospital, patients probably don't have blood. So what are you doing? Like you're watching patients die, and you're like, oh, I don't know what to do. That's not why you wanted to be a nurse, right? Like you wanted to be a doctor, you wanted to be a nurse to help people. And so if you're seeing problems, it's still your role or your job or your responsibility to find solutions to those problems anyhow best. So yeah, that's just a little bit about what I wanted to talk about. And just by acknowledging that I know the problems, I've been there, but I also know some of the steps that I took that have enabled me to build in healthcare for all these years. And to be honest, for forever, I don't think that I'll ever go back to clinical practice. I think that at the end of the day, my goal is always going to be, because once you find one problem and you try to solve that problem, you're going to find another problem. You're always going, so there's always going to be problems to solve, whether it's a problem that is relevant to your community, whether it's a more global problem. There's so many problems in healthcare. And I just think that the reason why healthcare is not probably the number one industry in the world is because we are not the ones building technologies. You see software developers go and they build apps and they build, all these technology platforms, and that becomes sort of like the number one leading, because those are people with the expertise and that understand that. So we cannot expect these software developers and these technologies to come and build in healthcare. If we want this to be the biggest, unicorn providing industry in the world, we need to come in with the expertise that we have, because it's only when we do that that we can build solutions and problems that really are relevant to the users, and then we make money out of it. So yeah, I hope that was helpful and that was insightful. But that is just my 2 cents on why we should be building as healthcare professionals.
Thank you, Melissa. That was great. Thanks. We can throw it open to questions and answers now. I will go first and ask specifically to your experience with Infuse Health. How have collaborations with investors and strategic partners helped you scale through challenges? And maybe if you can give success stories or particular situations where a collaboration with an investor or a partner was able to help you expand your business and scale, that would be great.
Yeah, sure. So I think one of like the particular things that we have an investor right now that's coming on board, and I actually met this investor 4 years ago, right? Like when we just started out, I met this investor 4 years ago. At that time, we were still focusing on like the on building blood donor network in Africa and like delivering blood to patients. And he told me, oh, you're still in Africa. He was based in the US. He's a physician in the US. And he said, oh, when you come into the US, call me. That was 4 years ago. It never really happened because, I came into the US, we already raised money. I never called him. And a few weeks ago, he calls me and he's like, well, I know you were still building on blood. And I had my daughter, his daughter, they're in the US, right? Like they're here in the most well-resourced country in the world. And his daughter goes into the hospital and they cannot find blood for his daughter. And he's calling me and he's like, are you still building on this? What is going on? So his daughter is sickle cell, she has like a lot of like health needs. And I told him, I mean, we're not doing that in the US, but this is what we're doing now. We're doing clinical trials. And he's like, oh my God, I would like for my daughter to be in a clinical trial because this is something that, she has struggled with her whole life. And now, they're investing in us and it's really just one of those of many situations where, a lot of the times what you're working on, where you are, can influence sort of like the sort of like decisions that you make and sort of open doors that you never even expected that you would get. Is the same way that, even like the investor that was able to like facilitate our expansion in the US was really just based around the fact that we were building for Africa. We were building. And in the region where we lived in New York, there's a huge immigrant population of people that are coming in from Africa and going to New York, and so they're thinking, how do we fund more companies that are addressing these communities? They understand that when it comes to things like clinical research, when it comes to like how do we bring in all of these different communities to take part in these studies? And so they found this company that is building for Africa. And so they're thinking, can you like translate that for Africans in America? So it's really just always around like finding the right investors that see your vision and that are able to open doors for you, right? Like they would say, oh, come, if you are able to open up an office in New York, we give you, $500,000, to be able to do that. And so those were some of like the things that we see that, having investors, being a nurse, building things that you understand. Again, it's this situation of not guessing problems. There's a huge thing in other industries where people build solutions and then try to find problems to solve those solutions with. But with healthcare, it's really, or with my situation, it was always around the fact that I was always addressing a pressing need because I was exposed to that. I saw those problems, and that's always how you should be able to leverage the fact that things that somebody that has never worked in a hospital knows, and how do you leverage that to be able to, get investors that either buy into that vision or get partners that you can communicate with, you can say the right things with, and that will be able to sort of like understand what you're saying. So, yeah.
Okay. Someone in the chat box has a question. So he wants to ask how healthcare professionals can bridge the gap between healthcare and entrepreneurship.
Again, the goal here should not be you bridging the gap. You are the gap, right? Like that gap between healthcare professionals and entrepreneurship needs to be filled by healthcare professionals. And I think that that's what the purpose of this seminar is to show that there is no gap. The gap that exists now is because healthcare professionals are not willing to become entrepreneurs, right? Again, people are happy, or people only think that the only way that you can contribute to healthcare is to work in a clinical setting, as opposed to really just switching it up and saying, I get it. The hospital is work, but a lot of these problems can really be solved by you being an entrepreneur. So for example, if you're a physician and you see 100 patients a day, you start thinking, how do I make sure that I keep seeing, 150 patients a day, but still maintain the same quality of care? And so you could go and start a telehealth company or telemedicine company. So it's really just around the gap that exists between entrepreneurship and healthcare needs to be filled by healthcare professionals. And that's what we're talking about today. As the healthcare professional, how are you that bridge? How are you saying, I'm going to be an entrepreneur and think about the business side, but I'm also going to be the person that is building this solution for the patients and all of that. So think of yourself as that middle part, as that gap that you're trying to fill, because the only reason why that gap exists is because more of us are not switching sides. So yeah.
Okay, I have another question for you. So, being a healthcare professional and a health tech player who plays in a relatively small niche, but not small, but you don't have as much visibility as you should have for a sector that is doing so much impactful work. How do you think the situation of health techs in Africa can influence the growth of the health tech economy? And what's your vision for the for the healthcare system in Africa?
Yeah. I think from my own experiences, in as much as I'm an entrepreneur, in as much as I'm a nurse, I think that I am also just like a person with my own sort of like personality. And I think that that's always what people fail to understand, is that when you look at entrepreneurs, we're not just entrepreneurs, we're still like people. And for me personally, as I've always said, my goal for wanting to build in healthcare was never from the perspective of gaining notoriety. It was never from the perspective of saying, I'm the next Steve Jobs, I'm the next Mark Zuckerberg, right? Like, I never wanted to be out there in terms of, oh, look at me building. I really just wanted to build. I think that I was really just driven by frustrations that, when I chose to be an entrepreneur, I always tell people, I'm like, my mom will not talk to me for 2 years because she's like, you're throwing away your life. Why are you doing this? But it was never from the perspective of trying to be rich or trying to gain notoriety or trying to do anything. I mean, now I'm trying to get out there because I understand how important visibility is. I understand how important it is for people to see things that they have not seen before. But for a very early part of my career, I was really just a nerd. I just wanted to build. I just wanted to get things done. I wanted to support the people that I could support, to do the things that they wanted to do within this same ecosystem. But as you said, rightfully, I think that it's important that people start speaking up. It's important that people start saying, "Oh, be a nurse, go be a nurse, be a doctor, go be a doctor, or be a nurse, be a doctor, go be an entrepreneur." And so people that are like in that space should obviously be more visible. Now, how that fit into my own personal characteristics or into my own personal traits is really just going to be up to me to figure out how to navigate that. But I just think that, again, if more people, whether you're somebody who wants visibility or not, whether you're somebody who just wants to build or not, but as long as you're somebody with that sort of like subject matter expertise, the more we come into this ecosystem as players, as builders, the more the patients will make the noise for you. Like, the patients will talk about you. The people that you're serving will talk about you. They will sing your praise, and it gives us that sort of like notoriety and visibility that we require. And again, I'm also just somebody that I believe that results should speak for you. Like, you should be able, your results should precede you. If you build a really good company, whatever happens after that is really just like a secondary outcome. And good companies are companies that solve real, actual problems. And that's what we need to be able to do. Build the good companies, put them out there, put as much as you can out there. Don't entirely change your personality into becoming some sort of like, celebrity or becoming like a messiah for healthcare. Because the most important thing as an entrepreneur is always think about patients. It's not about you. It's always about something bigger than you. It's always about mothers with children. It's always about the old people who cannot clean up after themselves. It's always about something bigger than you. And that's why, again, we just need to be ourselves. We're not the superstars. We're just the people that are, channeling or trying to guide the solutions that need to be provided within the space. So, yeah.
That's great. Thank you, Melissa. There are a couple more questions in the chat box for you. Martin says, "Hi, I would like to commend your presentation so far. It's been insightful. My question is, what measures can we take to mobilize more youths to donate blood via our platform, and what platform can we look into to seek grants and aids for his startup?"
Yes, I'm always so excited when I see people solving this problem of blood. Okay, like I'm excited about it because, again, it's a space that I know very deeply. It's and it's a really challenging space because there are so many moving parts that you need to be able to put together. And when it comes to youth and young people, I think that that's actually the easier part. People donating blood is the easier part, right? Like what you need, especially, is that as a young person yourself, always think about what you needed to hear or what you needed to see to be able to donate blood for patients. For us, for example, we really appeal to like younger people by like making social media and like promo campaigns that made donating blood look cool, right? Like we would make t-shirts that had people's like personalized blood groups on those t-shirts. We would make events that were just like catered to people that were of the same blood group type. It was always like something that you always had to think about it, that from as a young person, what would you be down to do that would make you want to donate blood. Young people are young and healthy. A few bags of blood here and there doesn't really do anything to them, but they just want to be able to know that they're having fun and that this thing that they're doing is pretty cool. Now, the problem with this business, in my opinion, and after doing it in 3 different countries, was always the people that were paying for it, right? Like you had to figure out who is paying for this. If it's the patient paying for this, you're thinking, what can the patient pay for it that makes it worth your while? Or if it's the government's paying for it, good luck to you on that end because, African governments, we know how that is. But that was always the harder part for me with trying to figure out this business, was always who was paying for it. With young people, tap into technology, tap into social media, tap into coolness, make it cool, make it fun, make it in a way that it becomes a social gathering, it becomes a social celebration, and you'll see people coming in to donate blood, and you'll never understand why. But it's just because young people want to be associated with things that are like fun and cool, and whatever that works for you will probably work for them as well. So yeah.
Great. Thank you, Melissa. There's another question for you in the chat box. How have you been able How have you been navigating the regulatory landscape since the regulators play a crucial role in recruitment of clinical trial patients?
Yeah, so again, this goes back to what we're talking about around like complexity of different ecosystems. For us right now, we've been able to do clinical trials in 6 different countries on the continent so far. And the thing that you can never assume is that any 2 countries are the same. No 2 countries are the same in Africa. And that's always something that you have to be very knowing of. You cannot be naive going into this thinking, oh, if I did this in Nigeria, I'm going to do this in Cameroon. We bother each other, but we're 2 different countries. And that's always something that you have to think about and think about. You have to do a lot of research. You have to find the right people that understand these regulatory frameworks in every country that you're going into. And it's not just clinical trials, even like the blood thing, the way that, that happened in Cameroon was different from the way it happened in Senegal. It was different from the way it happened in Cote d'Ivoire. So I was very naive thinking that, oh, all of Francophone Africa is the same. It's not. Different countries, different rules, different regulations. And as long as you abide by those regulations, you're fine. A lot of the countries have very well defined rules and regulations around what it takes to run a clinical trial, what it takes to recruit patients, and all of that. So as long as you have that information and you double check that, that information, if you stick to it, everything moves on smoothly. People want to be able to take part in these things. Yes, there is bureaucracy and all of that, but people want clinical trials to happen in their country. There are patients that want to take part in clinical trials. You just have to make sure that you do the right thing. And that's why, again, I keep emphasizing on the fact that your ethical and your moral compass has to be in the right place, because this is not just you trying to make money off of doing clinical trials, right? Like you're thinking about, there are real life patients involved here. How are you best explaining what clinical trials are? How are you best explaining the risks and the benefits and all of that? And that's always something that is just like really important for you to keep emphasizing as you go on like a country by country basis. So, yeah.
I think one more question would be, from your personal perspective as a player in the landscape, seeing the growth so far and what the potential is, what do you think about the future, the growth potential for the health tech startup ecosystem?
I do think that we still have a lot of work to do, but and I think that that work will be easier if it was being done by the right people. Unfortunately, a lot of the people that are being exposed to technology right now, and a lot of people that I'm seeing coming into this space are still not healthcare professionals. And that's why I really wanted to talk in this meeting or in this webinar, because yes, people are getting interested in healthcare. Yes, people are seeing that there's money in healthcare, but we're still not seeing the right people addressing these problems. We're still not seeing, there are a lot of people coming in here for the wrong reasons, and that is still a problem. And I'm hoping that, out of this seminar and out of the, I don't know how many people that are here, if we could even just have 1% of these people start thinking about how do I start a healthcare company, that is a move in the right direction. Where people are coming into this, it's growing, but in my opinion, it's still not the right type of people that are coming into this. It's still the people that are either technologists, it's still the people that are either, oh, I can raise money because I know how to talk to investors, but I'm still not seeing enough physicians, I'm still not seeing enough nurses, I'm still not seeing enough pharmacists, I'm still not seeing those types of people coming into healthcare. And I do think that that's something that worries me a little bit, but I hope that with more events like this we can start having more of us that thinking about that. So yeah, those are my opinions, and that's something that is really pretty scary for me with healthcare, especially in Africa as well.
That's great. Thanks, Melissa. There's a question in the chat. How does one who is not a healthcare professional nor a current investor navigate around supporting the healthcare sector? I think you can go first. I'll take it up. Okay.
Yeah. The first thing I would say with that is team up with a healthcare professional. Like, that is the first thing that I would say. If you're not a healthcare professional, the first person you should be teaming up with is a healthcare professional. Find your friend that is a doctor, find your friend that is a nurse, and make that person your co-founder, make that person your team member. And it's also like a trend that even within the United States we're seeing, where a lot of the times investors that invest in healthcare only invest because there is a member of that team that brings in that clinical expertise. If you're not a healthcare professional, first of all, it will be so frustrating for you, because healthcare is just a frustrating space in general, right? Like, so you don't want to go into a space where you're already just annoyed by everything. So team up with a healthcare professional. That is the only advice that I give people that are not from the healthcare that want to build in healthcare. It's so easy. Find a physician, find a nurse, find somebody within that space and team up with them. It gives you a lot of context. They explain things to you. They'll tell you, no, this is why this is happening. This is why the patient is behaving like this. This is why. So team up with a healthcare professional. That is the only advice that I would give if you were non-healthcare trying to build in healthcare.
That's fantastic. I mean, to buttress what Melissa just said, like they say, those who can't do teach. In this case, those who can't do support or invest or collaborate, right? Yeah. So even if you're not a healthcare professional, you can always, for instance, join the HCA Catalyst Syndicate Fund, where we invest in healthcare startups and also render support that are non-financial to them. It could be as far as business development or subject matter specific assistance or consultancy. You help in the capacity that you can and financially commit as well. That's just one of the things you do. There's so many ways you can support these health tech startups. Like Melissa said, you can collaborate with a health tech startup, or you can collaborate with a healthcare professional who is a founder, or you can join a community that has access to those health tech startups and render services where you can to the companies within the portfolio. So for instance, our Catalyst Syndicate is a business angel group that is predominantly focused on investing, but we also render non-financial support to our portfolio companies like Infuse Health, for instance, and a couple of other of them. We have 20 members. We've invested in 9 companies so far. Our portfolio is valued at over $18 million. Our portfolio companies operate across over 5 countries, and they've created over 1,000 jobs, right? So joining a community like this would give you more access to founders in the health tech space who you can collaborate with and support however you can, and also invest in the growth of the company and become a part of the company as well. Entrepreneurship is not an easy feat. It's not everyone can do it. That's the honest truth. So it's left for you to support however you can. There's another question for Melissa, I believe. What are the ways in which we can improve healthcare in Africa?
Wow. So that question makes me feel that this person asking is not a healthcare person because, again, all you need to do, to be honest, one day is take a day in your life and just go sit in a hospital lobby, right? Like just go sit, like it doesn't even have to be a day. It could be 2-3 hours of your day and go sit in a hospital lobby and see the suffering, right, that happens within these establishments. And I feel like when you do that, it will open up your eyes in like so many different ways that you can help and in so many different ways that you can support. And support could be in direct ways, there are more like direct things, again, like starting a company. There are more direct ways like investing in a company, right? And there are other indirect ways like even just doing things like going out and donating blood to a hospital. There are other more indirect ways like even just like taking care of yourself and taking care of the people around you. That is an indirect way that you support healthcare because you're not becoming just another case that has to go into the hospital and has to deal with that. To be honest, as I mentioned earlier, the problems are just a lot. Like there are just never ending problems, starting even just from like training physicians and training nurses to be able to handle the types of complex cases that come, problems that are more patient focused, even problems that are even more organizational focused, even just around like better managing hospitals, better managing healthcare establishments. There are so many problems, and it's really just for you to pick up your highest pain. A lot of people within healthcare are always like motivated by like a very specific pain. As I said, there was this investor of ours that was motivated by his daughter's sickle cell disease and like her inability to get blood. There are people that are motivated by, their family member dying from negligence. There are people that are motivated by just being in a hospital and seeing this, as in the case of healthcare professionals. So it's always just for you to figure out what has happened to you. Everybody has a healthcare story. If you live in Africa, you have a story. What has pained you so much that you feel that you can move the needle a little bit to support? A lot of the times when you see people even coming to donate blood, it's people that had been in that situation or had family members in that situation, and their way to support was to make sure that another person does not have to go through what they went through to be able to get blood, right? So always just think about you in general. If you're a healthcare person, if you're in Africa, what has pained you? If you're not in Africa, start thinking about what you have seen in like a place that you are, wherever you are, that you wish so badly could be in Africa. What else have you seen that you think that, okay, if only this thing existed in Africa, how easy would it be? For me, for example, I went to South Africa and I saw there's something they call the South African National Blood Banking Services. And it's the way South Africa like organizes, their blood donors and distributes blood. And I saw that when I was in nursing school, and I was just mind blown. And I thought, this is such an easy solution to be able to make sure that people get blood to be able, and that was sort of like the idea behind how we started that. So again, always just think about it. What has pained you if you've directly experienced it, or if you have not, have you seen? What else have you seen in whichever part of the world that you are that you would really love, or that you think that if adapted to the African context would drive change or make a difference? And that's how you improve. That's how it gets better. So yeah.
Thanks, Melissa. To add to her point, you don't even just necessarily have to be a person who has a pain point or has suffered something in the healthcare ecosystem. It could really just be a drive for social impact, seen as the healthcare system is a fulcrum of the economy, is something you want to help with. You see people across the road who are suffering, or you see people who need medical attention and they don't get it. There are always communities, NGOs, like this, all sorts of communities that you can join, volunteer in, invest in this ecosystem, or invest in health tech startups, or just advise them based on your capacity. Even as a healthcare professional, if you don't have the capacity to invest in the companies, or you can't, and you're not entrepreneurial per se, or aren't looking to start up a fund, you can consult or partner with one of these companies and give them your subject matter expertise. I think someone asked how you can join or benefit from the Catalyst Syndicate. There should be a link in the chat box where you can register and join. And if you have any questions, send your inquiries through the form. We will attend to you. There's also our email address where you can send us an email. We're always available 24/7 to give you feedback on anything that you need. So yeah. Okay, there's another question. How can non-healthcare founders find healthcare professionals willing to commit to building a venture, especially when there are no immediate benefits or an offer? Melissa, I think that's for you.
Yeah. Again, I think that people underestimate how willing people are willing to help, or how willing people are willing to get involved even when there are no immediate benefits. And that's another thing that I think that really differentiates healthcare professionals from other professions, because I really doubt if a doctor or somebody would turn you down for saying, look, I'm trying to build this thing that is going to do this thing with healthcare. I just need your input, or I just need you to be available for 1 hour a day to, I don't know, talk to patients or give me insights. It's literally an oath that we take to do things that benefit patients. So unless, again, somebody is just like completely morally skewed, or there is, something that is wrong, you really underestimate how willing these people are to help and to find solutions that can help. Obviously, you don't want to be a burden. Obviously, if there's no immediate sort of like, oh, if you're not paying somebody or something, you don't want to burden them where it takes time off away from them actually doing other things that could still be helping patients, but then they're still making a living. But just put yourself out there, to be honest, like talk to people. If you have friends or if you have friends, or if you have neighbors, if you know anybody, you would be shocked at how willing people are, open to helping and just giving you feedback, even if there is no immediate benefit, because it's literally an oath that they take or that we take that says that we are committed to finding and, helping the people that we serve. So just put yourself out there, try to talk to people, and you never know what you would find. So, yeah.
Thanks, Melissa. We're over time, but I think there's one more question and we'll call it a day. Yeah. This person is a student and asking how medical students can contribute to improving healthcare in Africa.
Again, never underestimate yourself because you're a student, or because I was a student, right? Like I tell people I was a nursing student when I started this company. So again, you should never be limited by the fact that you're a student. As a matter of fact, as a student, what that makes me see is that you have a lot more energy, right? So you're able to take a lot more punches, right? Like if people are like saying no, yes, you're like whatever, right? Like it doesn't really affect you. You're still going to go back to school. Your parents are still going to send you pocket money or whatever that is. But it's always just important to think about the fact that I started this when I was a student, and it has grown since then. So you always have to keep thinking, as a student, how do you take advantage of the fact that, first of all, you have your other students that you can talk to, you have your lecturers and your professors that you can talk to, you have access to all these hospitals, right? You have, as a medical student, you're doing your clinicals and all of that. How are you taking advantage of this access that you have right now to learn more about some of the challenges and problems that people have? Because it's only from that sort of like information that you get that then you're able to start formulating, startup ideas and things that you can solve. So take advantage of it. As a student, you're in a really good position because you have so much more access than even somebody that already has a job and is constrained to just like one hospital or one place. As a student, you're moving all around the country, you're having classmates, you're having professors and your lecturers to talk to. Take advantage of that and start thinking about all the ideas and talking to people about how you can solve some of these problems. So, yeah.
Thanks, Melissa. That was fantastic. If you would like to get in touch with Melissa, just send us an email or send us a message and we can relay any message to you. If you would like to collaborate with other health tech ecosystems or health tech startups, fill out the form. We have a form in the chat box for all healthcare professionals. So you can fill out the survey form, fill out the questions that you have. We'll get back to you on the questions and we can see how we can work with you.
Sure.
Thank you, everyone, for your time.
Everyone.
Thank you, Melissa, for taking the time to speak with us. Thank you, everyone, for taking the time to join. It's been an absolute pleasure.
Yeah.
Have a great day.
Have a good day. Yeah. Bye.